Hi, everyone. My name is John Hansel from Human API. I'm the Vice President of Business Development at Human API. I'm excited to share the Human API story today, talk a little bit about our company, and also talk about one of the customers that we're working with, Omada Health. Actually, both Human API and Omada Health are powered by AWS. So thank you to Amazon for inviting us to present today. Omada Health is a digital health company that we're going to talk more about in this presentation. But before I do that, I wanted to provide just a little bit of background on Human API and really tell our story, how Human API came to be, and the solution we offer in the healthcare space. So really quickly, some background on Human API. When we started out to solve problems in the healthcare space, there are really two fundamental questions that we're trying to answer. The first, and I think this resonates really with anyone, is why can't consumers easily get access to their own healthcare data? Everyone's been to the doctor, everyone goes to the pharmacy, a lot of people have a Fitbit or a wearable device. People have healthcare data everywhere. The challenge is it's really hard to get that all in one place. It's at one doctor's office, at another hospital, on a wearable device. There's no standard for a consumer or a patient to be able to access their own healthcare data. And from the perspective of a company or an enterprise, like an insurance company or a pharmaceutical company or a digital health company, there are a lot of challenges getting healthcare information on their customers, on their users, on their patients. Enterprises really struggle to connect all of the healthcare information on an individual person, and that makes it really hard for them to innovate, to build new solutions, to offer new products to patients, to consumers. So from the perspective of an enterprise, really the core problem that Human API is solving is that healthcare data is everywhere. It's highly complex, it's highly fragmented. A lot of the healthcare information from an electronic health record or from lab results or from a wearable device is very unstructured data. It can be found in doctor's notes or it's stored in a non-standard format. It's in a lot of different places. As I mentioned, it could be at one doctor's office and also at a hospital and also at another specialist's office and at LabCorp and at CVS and on my Fitbit. It's really challenging to pull all of that information together. And when an enterprise does want healthcare information, it can be very slow to acquire that information. We're talking fax machines and phone calls. A lot of healthcare is transacted historically on paper. Electronic health records have started to appear in the last 10 years, but still a lot of healthcare is transacted in unstructured information that's not stored in a standard way. It can be very expensive to access that information. Just call up a doctor's office and try to get your 100 pages of medical records, and they can charge you sometimes over $100 to acquire your medical history. So there are a lot of challenges for an enterprise and for a consumer in getting healthcare data. So how does Human API come in? We're on a mission to basically radically accelerate the pace of healthcare innovation by making it easier for consumers to share their healthcare data and making it easier for enterprises to acquire that healthcare data so they can build new products. And we're going to go into an example of a customer called Omada Health who uses Human API on the AWS platform to really innovate with a new digital health offering. And that example is kind of core to the mission of Human API, to help companies like Omada Health to innovate using healthcare data. So there are a lot of examples of this in other industries. Essentially, what Human API is doing is trying to be the modern transaction layer for consumer health data. If you think about the financial industry and all of the new APIs that power those transactions, everything from being able to log into your online bank account to transact with your phone at a convenience store, to pay with PayPal. All of that is powered by a modern transaction layer for the finance industry. Human API is like that for healthcare data. Imagine a consumer being able to leverage APIs behind the scenes to very quickly acquire all of their healthcare data and share it with a new doctor, or log into a new digital health app and very quickly import all of their medical history. Human API has built that transaction layer that enables companies like you see here, but healthcare companies, to build really cool, innovative solutions using modern APIs to acquire and make sense of healthcare data. So here's a visual of really what that ecosystem looks like. And the core concept here for Human API is putting the consumer at the center. So on the left-hand side, you can see some examples of all the different sources of health data. So as an individual, I might be tracking my health in a healthcare app. I belong to a health plan, so I've got insurance claims for my health plan. Of course, I've got my medical records for every time I've been to the doctor. I visit a pharmacy to fill my prescriptions. I use various medical devices. I might be tracking my heart rate or my blood pressure on a medical device. I might be tracking my steps on a fitness tracker. I go to independent labs like LabCorp or Quest and get a metabolic panel, and I have lab results. The challenge is that healthcare data is in multiple different databases, in multiple different formats. I, as a consumer, don't have access to it directly very easily. But more importantly, for Human API, which sells a solution to enterprises, the enterprises, or the businesses on the right-hand side of this slide, have a very hard time getting all of that information in a structured way. So these are the type of companies that Human API has as customers: life insurance companies who need healthcare data for underwriting, healthcare providers or doctors who need to know a patient's medical history, digital health companies like Omada, that's the example we're going to go through today, who needs to understand a patient's lab results or their previous medical history or details about their activity and how many steps or what their weight loss is or what their current blood pressure is. Health insurance companies like a health plan, like a Blue Shield. When you join as a new member, they don't know anything about your medical history. Clinical research, like pharmaceutical companies doing clinical trials, need to understand the medical context of patients. They need to be able to import medical data. What Human API has done is created the ability for a consumer or a patient to point to where all of their healthcare data is, and then share that information through a modern API transaction level with enterprises like the ones you see on the right-hand side of this slide. It's really a two-sided network with the health data on one side and then the enterprise solutions or the innovation by enterprises on the right-hand side. So let's just talk through really quickly and sort of visualize what this experience is like. From a consumer's perspective, what Human API has done is built a web-based software application powered by AWS that enables a consumer on a mobile device or a web app to very quickly identify where is my healthcare data, log into their patient portal or to their Walgreens account or to their Fitbit account or to thousands of other sources of healthcare data, and really quickly authorize the sharing of that information with an enterprise like Omada Health or like Blue Shield or like their new doctor. And it's a very simple, almost like a PayPal-like experience, but for healthcare data for a consumer to connect their medical information and share it. To do that, Human API has had to build a massive data network, essentially of every healthcare data source in the country. So to date, really over the past 3 years, we've built out a network of healthcare data sources that include hospitals, doctors' offices, every electronic health record vendor, every commercial laboratory, every independent pharmacy, every medical device, healthcare app, health plan. As I mentioned, all those sources of healthcare data, we've had to build integrations into those sources of data, essentially build the pipes to go pull medical information with an authorization from the patient, to then host that information in the AWS cloud using the Human API platform. That equates to about 20,000 unique data integrations, about 90% of healthcare providers in the US. So when I mentioned a two-sided network, the data sources are one key side of the network, which is all the integrations that we built on the Human API platform. So you can see just some examples here of CVS, LabCorp, Rite Aid. This is meant to represent nearly every healthcare provider in the country that is a source of healthcare data has been integrated into the Human API network, so we can connect that data and then share it with enterprises. The second piece of our solution after building the integrations of the data network is what we call Health Graph, which is the system we use to make sense of that data. I mentioned earlier that healthcare data is very complex, it's very fragmented, it's not very standardized. So a big part of our solution is transforming that data, essentially, adding codes, adding descriptions, categorizing the information, making it easy for an enterprise to ingest and run rules against and build solutions. So you'll see when we talk about Omada, they want to bring in medication information, they want to bring in steps and activity, they want to bring in laboratory results. In order to do that and for them to power their app, we have to normalize that information and make it useful through a modern API. The output of that is much more straightforward. We take all of that complex healthcare information and we run it through our Health Graph platform and offer it as a solution to our enterprise customers in the form of a RESTful API. And there are really two categories of API that Human API offers. First is our clinical API. This is essentially the electronic health record, things that you would create by visiting the doctor or going to a hospital. So diagnosis codes, doctor visits, encounters, all of your vital signs like blood pressure or BMI, doctor's notes, procedures, labs tests, medication, prescriptions, etc. The second solution is our Wearables API, which is more related to medical devices and things that you would wear to track steps and activity, heart rate, sleep, meals, blood pressure, sort of remote patient monitoring data that's not necessarily captured by the hospital, it's captured by the patient in their home or as they move around outside of the doctor's office. So those are two examples of the core APIs that Human API offers to enterprises. Data enrichment is also a big part of what we offer to our enterprise customers. And what we mean by this is not just normalizing the data, but really making sense of it. We've built software on the Human API platform powered by AWS to present this information in meaningful ways, to present the full medical record of an individual patient, to trend their labs, to highlight outliers, to make it easy for our enterprise customers to make sense of this healthcare data, to build solutions on top of this healthcare data, and to make decisions that impact their users or their customers. So when we go through some screenshots of Human API, you'll see this information presented not just in the format of a raw API output, but in the form of solutions that we've built on our platform on top of that data. Another key part of what we do is the speed of delivery. I mentioned this earlier, but the challenge of getting healthcare information is oftentimes about speed. It can take 2 weeks, 3 weeks, a month sometimes when an enterprise requests the medical records on an individual. We speed that up to about 6 minutes. We can get the full medical record on an individual from their electronic health record in about 6 minutes. It only gets faster from there. The wearables data comes in every 30 seconds. We can retrieve pharmacy data in about 1 minute. Again, this speeds up the cycle by which our customers can offer a solution to their patients or users. Instant insights, instant decisions by retrieving medical data through a modern API very, very quickly with the consent and authorization of the user or the patient. So speed is a big part of this, not just the normalization of the data, but getting it quickly through a modern transaction layer is a key part of this. Finally, this is a healthcare solution. So data security and privacy is paramount here. The Human API solution, and one of the reasons we selected AWS is that Human API needs to be a HIPAA compliant solution. So that's all the healthcare regulations around the security of personal health information. We go through annual audits. For example, a SOC 2 audit is something we completed recently to ensure the security and privacy of the data that we manage in the AWS cloud. This is a very key point when building a software application in healthcare and managing personal health information. I think we talked about this already, but the key concept here is that healthcare data through Human API is controlled by the consumer. It's basically a B2B to C business model at Human API, where we sell to enterprises and they acquire data from their consumers. So this is just another visualization of the healthcare data sources flowing to the enterprise solutions through the consumer. When I say enterprises, I mentioned this earlier, but each of these enterprises or categories have many different use cases. I'm going to drill in a little bit more into the Omada use case, which is a digital health solution, specifically chronic disease management around diabetes. In clinical research, we're talking about clinical trial recruitment and using medical data to more efficiently screen patients for clinical trials. In healthcare provider world, this is doctors' offices and hospitals, we're using Human API to onboard new patients, to understand a patient's medical history. If they've never been to that doctor before, what is their entire medical history? Essentially replacing all the forms that you have to fill out in the doctor's office waiting room. For health plans, this is for new member onboarding. So when you join a new health plan, when you go to a new employer, that new health plan doesn't know anything about your medical history. So being able to quickly import your full medical records is very important. Employee wellness, every employer these days offers a wellness program. With the Human API Wearables API, we enable those employers to offer essentially a bring your own device option where they can use any wearable device to import steps and activity and manage an employee wellness program. And then finally, in life insurance and disability insurance, medical records are very important. If you've ever applied for life insurance, you know that you have to go through medical underwriting, where they have to pull your full medical history, oftentimes send a nurse to your house to retrieve blood samples and take measurements. Human API speeds up that process in some cases by more than 30 days. So let's talk a little bit more about Omada. I have a quote here from Omada. This is a digital health company in San Francisco. They, like Human API, are powered by AWS. They were looking for a solution that enabled them to do two things. One, they wanted their users to be able to track their activity and steps and quickly import that into the Omada app, so they could make sure that individuals with diabetes were staying active. But they didn't want to mandate that they use one particular device. They could use any device. And using Human API sort of as a one-stop shop, they used our modern APIs to import activity data from hundreds of different devices. Secondly, Omada wants to bring in lab results, medication information, pharmacy information, so they can understand the medical context of the patients that use the Omada Health app for managing their diabetes. So it was a perfect fit, really, for Human API that offers both a wearable API and a medical API to Omada Health. Here's what it looks like. It's a simple request to an end user of the Omada Health app to share your health records in minutes. If you've ever used a patient portal, just click here and share my health accounts. This is Human API embedded into an Omada sort of web-based or digital experience. The user simply goes through really a 2-minute electronic authorization that says, I authorize the sharing of my medical data with Omada. Human API navigates them to tell us where you went to the doctor or where is your healthcare data. The individual might click on Kaiser, for example, and it would prompt them similar to connecting your online bank account through PayPal. In this case, it prompts the user to connect their online patient portal account. In this example, it's Kaiser, but I would just type in my username and password for the Kaiser portal. I would click Connect Account, and my entire medical record from Kaiser for the past 10 years would instantly be transferred to Omada in a few minutes through the Human API, JSON output of our RESTful API, on top of which Omada has built all sorts of solutions to provide insights and rules around how they might offer solutions to that particular diabetic patient who's using the Omada app. So here's an example of the full medical record coming in. You can see my recent test results. You can see vitals. You can see a recent lipid panel that this individual user might have had. All of that data is transferred to our enterprise customer. And all of the connections, there could be thousands of these every day as users go through, authorize the sharing of their medical information. In real time, that's shared with our enterprise customers. And then Human API offers a web-based software application, essentially an enterprise portal that's powered by AWS, where enterprise customers like Omada can come and manage all of those transactions. They can see which users have connected which healthcare data sources. They can drill down into the details. They can export that information. It's all managed through this web-hosted enterprise portal application from Human API. So with that, I just want to wrap up. We provided a detailed example of how Omada Health is using the Human API platform powered by AWS as one example of a digital health company that is already accelerating healthcare innovation by using modern data APIs, which are really doing what we set out to do, which is unlock health data liquidity to make it easier for companies like Omada to use cloud-based platforms to create really new innovation in the healthcare space. So with that, I'm going to wrap up and say thank you, and thank you to Amazon. My contact information is here. Again, it's john@humanapi.co. We'd love to hear from you, and thank you, everyone.